All right, hello and welcome to those of you who have joined us early for this live telephone town hall meeting. Thank you for joining California's 33rd Congressional District. We're here with Congressman Ted Lieu, who represents you, and we're here to do an overview of the recent stimulus package. Then we'll hear from an expert guest speaker. We have Dr. Jeff Gunzenhauser, Chief Medical Officer of the Department of Public Health. He's here to help give updates and to help answer questions. Now, you can press 0 at any time to submit a question for Q&A if you would like. 0 will take you to one of our operators. They'll have the opportunity to take down some notes, and then we'll be taking your questions live throughout this Q&A today. You can also press 7 to get email updates from Congressman Lieu's office moving forward. Again, 7 if you'd like to get email updates from Congressman Lieu as we move forward, and 0 if you'd like to ask a question. We're going to start this live forum in just a moment. We'll hear some updates from Congressman Lieu. We'll also hear some updates from Dr. Gunzenhauser, and then when we've gotten through that, we'll go right into Q&A, and we'll spend most of our time tonight on Q&A with you folks in our live audience. So again, if you've already got a question in mind, feel free to press 0. Submit that question to an operator. We'll put you in line to ask it live. And then if you're not comfortable asking your question live, make sure you let your operator know that. And I'm happy to read your question if that's your preference. So again, 0 to submit a question. Let your operator know if you'd like me to read it instead of bringing you live. Otherwise, I'm happy to bring you up to ask your question of the Congressman live in our forum tonight. We'll also run a survey question in a little bit here. You'll be able to vote on that. We do appreciate that feedback as well. And as you're listening, even if you don't have a question now, be thinking about questions you'd like to submit for our live forum. We are going to spend most of the time on Q&A, so we want to make sure that we get as many questions answered as we possibly can in the time that we have. Again, 0 to submit a question, and once more, 7. Press 7 if you'd like to get email updates from Congressman Lieu's office moving forward. We're going to go ahead and get started now, but remember that at any time you can submit a question by pressing 0. At any time you can press 7 to get email updates. And it's my pleasure to welcome California's 33rd Congressional District to this live forum. I'll turn it over now to your Congressman, Ted Lieu.
Hello, this is Congressman Ted Lieu, and I'm so honored you're joining us on this call. Tonight, Congress passed the COVID relief package, as well as the annual spending bill. I'm going to give you an update primarily on the COVID relief package. And then we've got Dr. Gunzenhauser, who is the Chief Medical Officer for the LA County Department of Health, and he's going to also provide an update. And then we're both going to answer any questions that you may have. So the COVID relief package was a little over $900 billion. My view is it was not sufficient to address the scale of the pandemic we are in. However, it is better than nothing. That is why I voted for it. So I'm going to go through some of the provisions. It has in there $25 billion to assist renters, plus an additional 1-month extension of the eviction moratorium. It has $82 billion going to education, of which $54.3 billion will be going to K through 12 schools. It has direct stimulus checks to the American people of $600 per person. So a family of 4 would get $2,400 because children are included in that. It also has an extension of federal unemployment benefits of $300 additional dollars. In addition, it's got money for broadband of $7 billion to get it out to people who need it, especially for all the students who are going through remote learning. It also has some policy changes. So it does end surprise medical billing. As some of you may know, that's an issue where, let's say you go get some sort of surgery and you think everything's covered by insurance, and then a month later you get this bill from the anesthesiologist who you don't know, and all of a sudden you're liable for another $400. This would stop that from happening, and it protects the patient and the consumer. And so the anesthesiologist will now have to work out with the insurance company and have to bill through insurance so you don't get a surprise medical bill. It has a lot of additional funding, billions of dollars, to make sure that the vaccine is distributed quickly and efficiently to the American people. And people need to understand it's a huge logistical issue, right, to get, for example, the Pfizer vaccine, which has to be stored at negative 80 degrees below zero, and then make sure that that gets out to all 50 states and all these hospitals, and then it gets to the patient. So we've got billions of dollars for that as well. Those are some of the provisions in there. I had hoped that we could have done more. The House of Representatives did pass 4 laws earlier this year, including the CARES Act, that did provide stimulus checks and funding for hospitals and small businesses and so on. And at that time, I thought that was good, but again, not sufficient for the scale of the pandemic. So on May 15th, the House passed a $3.4 trillion HEROES Act. Unfortunately, the Senate blocked that, as did the White House. So then we tried later on a $2.2 trillion version that, again, the Senate stopped, as well as the White House. So finally, we're able to get this much smaller one of a little over $900 billion. My hope is that going into next year, when President Biden is in office, we can do another stimulus package. And one other point about the stimulus, it does have over $280 billion of additional PPP loans for small businesses, of which those loans are forgivable. So that's an update on that front. And now I'd like to introduce Dr. Jeffrey Gunzenhauser. He is the Chief Medical Officer and Director of the Disease Control Bureau in Los Angeles County's Public Health Department. He has practiced as a board-certified preventive medicine specialist for more than 30 years and has held numerous positions and addressed many public health challenges. He is a graduate of the U.S. Military Academy at West Point, New York, and completed his medical training at the Uniformed Services University School of Medicine in Bethesda, Maryland. He served for more than 20 years as a public health physician in the U.S. Army, including serving as the commander of their 227th Medical Detachment in support of Operation Restore Hope in Somalia, and as a preventive medicine advisor to the Army Surgeon General at the time of the Pentagon attack and early phases of the wars in Afghanistan and Iraq. After joining LA County in 2003, he led the department's efforts to achieve national accreditation with the Public Health Accreditation Board, and as the director of the Disease Control Bureau here, he has led LA County's response to the threats of Ebola, Zika, typhus, hepatitis A, measles, and now this coronavirus. So we're so pleased to have Dr. Gunzenhauser with us today. And if you would like to take it away, sir, please tell the folks on this call what's happening with the virus in LA County.
Thank you so much, Congressman Lieu. I really appreciate your kind words, and it's really a pleasure. Thank you for inviting me on behalf of the Department of Public Health here to give some updates about the status of COVID-19 here in Los Angeles County. I'm just going to cover a few areas. One is, I'm sure many of you follow the news and know the situation, but I'll give you the basic situation here in LA County. I'll then talk about the current order that's been issued by the governor and also by our health officer here and what those provisions are. I'll talk briefly, I'm sure you've been following in the news, the vaccines. As you mentioned, Congressman Lieu, everybody's very excited about that. Just make sure everybody's on the board with that. And then just close with some comments about recommendations for people to be safe and to be thinking about the holidays. As you all know, we're at the time of the year when generally we're celebrating with joy and spending a lot of time with family. And of course, this year with the pandemic, it has changed all of that tremendously. And I can tell you that with all my colleagues in the health department and everyone that I'm working with, we're all in this together here in LA County, trying to find our best ways forward, not only to celebrate with joy these holidays, but also to be safe, but also to figure out the best ways to keep our economy open and so on going forward. I'm sure you've heard some of the statistics. They're rather dire. Today we're reporting an additional 56 deaths here in LA County. We're almost at 9,000 deaths. We're a little over 8,900 today. We're reporting an additional 11,271 cases. And currently in our hospitals here in LA County, there's over 5,700 people diagnosed with COVID. That's about an additional 150 or so from yesterday. And over 1,000 of them are in our intensive care units. These numbers are staggering. Frankly, they're difficult to track. I've never really, in my career as a public health physician, never dealt with anything like this at all. And keeping track of this and et cetera is mind-boggling. We're very hopeful with the two surges that we went through in April and July that we wouldn't see anything like those again. But the reality is what we're experiencing now is much more dire than we experienced in July. Basically, our cases have accelerated by nearly 900% since the beginning of November. Our hospitalizations are up almost sevenfold since the beginning of November. And our deaths had been down around 10 a day, and so now we're averaging about 84, and so those are up at a very unacceptable level as well. Another area of impact that's of great concern is affecting healthcare workers as well. These are the folks who are staffing our emergency departments that today are overflowing, working in our intensive care units, working in our primary care clinics. We reported last week more than 2,000 healthcare workers infected now with COVID-19. In the past 3 weeks, it's been over 5,500 healthcare workers who've gotten infected. So by doing their work, by doing their duty, and by doing other things in the community, like all of us, they can be exposed to this virus. And while we hope them all well, obviously this is having an impact on our healthcare system at the same time. I will update you briefly on the order that's in place, the instructions that apply to all of us. This is an order issued by Governor Newsom and the state health officer, and also Dr. Muntu Davis, who's our county health officer here in LA County, have put out some stay-at-home orders. The order is largely driven by the capacity of the healthcare system. Some of you may have heard of this. There was concern, as we've observed, that the healthcare system might be overrun by the extent of the virus spread. And so the governor had set a threshold that if the intensive care unit capacity in any of the regions in the state went below 15% left, this order would automatically go into effect. We went below the 15% threshold on Saturday, I believe that was December 5th. So as a result of that, we've been under the state's order since Sunday, the 6th of December. And it's in effect for, it's temporary, it's in effect for 3 weeks, which means if we could get our capacity back up to where it should be, the order would expire next Sunday, the 27th. However, as of today, the state is estimating that the ICU capacity in the Southern California region is actually at 0%. And what that means is that hospitals have actually had to expand their capacity beyond what it was in order to treat additional patients who've come in. So being at that level of 0% and with the current rise in cases, et cetera, it will be some time before we'll come off of the state's order. The primary message from the governor and from our health officer is asking, really directing all of us as residents here in Los Angeles County to stay at home as much as possible. And we should just go out for really two categories. One is essential activities. So if you're an essential worker, whatever that may be, of course, hopefully you can telecommute, but if you have to go to a location that requires you to do that, then you're certainly encouraged and hopefully you're able to do that. Or if you need to go receive essential services, if you have to go to health care, if you have to get groceries, of course, those are things we all need to do. So anything around essential activities, the necessities of life, those are permitted. And also, unlike the stay-at-home order that went in effect in March, people are also encouraged to go out for outdoor recreation, but really only with members of your own household. But there's a lot you can do. Go out for walks. The parks and trails are open. Getting exercise and just enjoying the lovely weather that we're having right now is good for our physical well-being as well as our emotional well-being. So we do encourage everybody to take advantage of that. Of course, if you go out, wear a face covering, keep your distance at least 6 feet from anyone who's not in your household. Don't be involved in any gatherings, etc. I'm sure you've heard of all of that. Some facilities that I'm sure you're aware of, but if you haven't, there are some facilities whose operations are temporarily suspended under this order, and those includes like the card rooms here in LA County, wineries, breweries, and distilleries, except for retail. Our museums are closed, our zoos are closed, aquariums are closed, personal care services such as barber shops and family entertainment are closed. But a lot of things do remain open. As I mentioned, essential critical infrastructure such as government, healthcare, the court system, getting food, communications, and a lot of manufacturing that's essential to our way of life remains open. Grocery stores and retail stores are open with restricted occupancy. I'm sure you've heard of that. I've talked with people about that. I really do think it's important when you do go out, do have a plan that if it is crowded, if there's a long line, maybe come back at another time. You want to be safe, but those operations are open, and you just want to go to them in a way that's safe for you. Restaurants are open for takeout and delivery only. Outdoor fitness facilities are open, as I mentioned, parks and trails and playgrounds as well. And so that's that is the situation that we're in right now, and that is the orders that we're all under. I do want to talk briefly about the vaccines. I'm sure you've heard a lot of news about this. As Representative Lieu said, there's the Pfizer vaccine was granted an emergency use authorization by the Food and Drug Administration, and the Accreditation Council for Immunization Practices approved that vaccine a little over a week ago, and we got our first doses last week here in LA County. We received a little over 82,000 doses. And the other good news is there's a second vaccine manufacturer, Moderna, that was also reviewed by the FDA last week and also got approval by the CDC over the weekend, and they're making a similar vaccine. And so this week in LA County, we're expecting an additional 48,000 doses from Pfizer, and we're expecting to receive 166,000 doses from Moderna. Obviously, with 10 million folks in LA County, and with these two vaccines, everybody would have to get 2 doses. That's 20 million doses, so, sort of looking at the total of what we received, which is 300,000. That's like 3% for the first dose. We have a long way to go to get everybody vaccinated who wants it here in LA County. But this is a good start. We've learned a lot from it, and we're moving forward. People wonder, who is it that is receiving the vaccine? Really, there's two criteria that we look at it when we're figuring out who gets vaccinated. And these criteria, have been reviewed both by our healthcare colleagues at the federal level. The state has looked at it. We reviewed it here in LA County. And one is who is most at risk from having the most serious health consequences, and then also who are the workers who are most important and might be being exposed. So the vaccination rollout involves a number of phases, and we're in phase 1. And in phase 1, there are several different areas. Our primary focus with these first doses is healthcare workers who are on the front lines, and also trying to vaccinate residents who live in our skilled nursing facilities. You may know that here in LA County, we've got about 339 independent skilled nursing facilities. The number of residents there is a little bit over 30,000, and with the staff who are supporting them, there's about 70,000 people that need to be vaccinated. You probably know that that population has sustained the highest toll of mortality, with over 2,500 residents who've passed away here in LA County in those facilities this year. We estimate that there's probably a little over 500,000 healthcare workers here in LA County who are working on the front lines. And so this past week we were targeting healthcare workers who are in the acute care hospitals, who are in emergency departments and elsewhere providing care to folks who have COVID or are likely to have it. And so that's been our target the first week. With the doses that we received this week, we're expecting to expand out to begin vaccinating residents and healthcare workers in the skilled nursing facilities. And also we want to provide vaccine to our paramedics and our emergency medical technicians, our EMTs, who are responding to emergencies throughout the county, and make sure that they're protected. So those are our initial plans. Later when more vaccine becomes available, we're going to roll this out to other individuals who are high risk. In phase 1B, we'll be targeting individuals over the age of 65. And in addition, we'll be targeting essential workers who are in close contact and might be exposed to this virus. And then in phase 1C, we'll be targeting other individuals, probably in the age group of 65 and up, particularly if they have underlying medical conditions, and further expanding the vaccine out to provide this to additional frontline workers who might be exposed to this vaccine. And so a lot of that preparatory work is going on now. We expect to receive weekly doses, both from Pfizer and from Moderna going forward. We're hopeful those numbers will continue to increase. We're hopeful we'll have hundreds of thousands, if not millions, of doses here soon so that we can eventually roll this vaccine out to others. Based on what we've heard, probably this vaccine will be available for the wider public. It will be a while. I'm sure you've heard these forecasts from various individuals, but maybe by late spring, but it could very well be in the summer before it's widely available. But there's many millions of people with conditions and who are doing essential work that'll be getting the vaccine on the path before we reach opening it up to the general public. I think I will just conclude by just making a few comments. I do think it is important for everybody to realize we're obviously in a very dire situation. This is a pandemic, unlike anything any of us has ever experienced. We're at a very difficult time. We've had a long journey to get here. Many people are already exhausted, and we all wish that this was just done. But we are at a moment when we really have to take stock of the situation and realize it is in our power to protect ourselves, protect our families, protect the people that we love, protect the people that we work with. And so we are very concerned in the health department that what we're seeing is a surge largely due to things perhaps from Thanksgiving, but also we do know that some folks are not in full compliance with the things that we've asked. And of course, just the weather with, less than 10 hours of daylight, people are spending more time indoors. So there's probably a variety of factors that have contributed to the acceleration. But what we are asking, as I said at the very beginning, as the governor has asked, the most important thing to do is to simply stay at home as much as time as possible, and to absolutely spend no time at all with any person who's not a member of your family, unless somehow it's related to an essential work activity, as many of us are involved. If you are sick, please, I do ask this, please seek health care. We do have many folks who've become ill, and because of their concern or fears, have deferred from receiving care that not only could have kept them healthy, but really could have saved their lives. So for some reason, this is the one exception. If you do think you're ill, call ahead. Say, hey, this is what I'm experiencing. Should I come in? What should I do? Please don't delay on making that call. If you know it's serious, go in. I had to see my personal physician for something a couple of weeks ago. That visit went very well, was very safe, and the issues that I had were taken care of. So I encourage all of you to do that. I do recommend that when your turn for the vaccine comes, I strongly recommend you consider getting it. It is important to realize that the vaccines now available are not fully licensed. They're still in the clinical trials that will go on for a while, but the preliminary evidence shows that they are much more effective than we really had thought. 2 doses, 95% protection. Extraordinary. So I do encourage you to take a look at that. It really is voluntary. It's up to you. You'll be provided information when your turn comes. Read that information carefully. And if you have any concerns, the balance of getting COVID versus the balance of getting the risks, many people find that the balance is in favor of getting the vaccine. So encourage you to take a look at that when your time comes up. And in the meantime, I just encourage people to be creative and think of fun and new ways to enjoy the holidays, because this is the time to celebrate love, to celebrate our families, the joys of things that we have. And I know that many people are finding ways to do that. Of course, it'll be different than we have in the past, but I know many people are finding ways to do that. So with that, that concludes my remarks. And again, I really appreciate Congressman Lieu, you're inviting the Health Department to speak this evening, and I'm glad to help with any questions that attendees this evening might have.
Thank you, Dr. Gunzenhauser. Really appreciate your comments. And now we'll open up for questions.
Got it, Congressman. Thank you. And a reminder to those of you who may have joined us a little late, if you'd like to give us your email address to get email updates from Congressman Lieu's office moving forward, please press 7 on your phone. Again, 7 to get email updates from the Congressman's office. We'll get your email address, make sure we keep you updated on the issues that affect you moving forward. We're going to go to Ruth first with our first question coming from Agora Hills. Ruth, thank you for joining us. Go ahead with your question for the Congressman, please.
Yes, Congressman Lieu, first of all, thank you for all you do. And it takes a lot of courage for both of you now to act. And my original question is for Dr. Gunzenhauser is, I'm 73 and have cancer, and do I have to apply with my doctor to get the vaccine, or how will people automatically know that it's their time, that the vaccine is available for them?
Thank you, Ruth. That's a very good question. I can say that we are working out the details. I think you've probably heard that, particularly with the Pfizer vaccine, it's a rather complicated logistics. It has to be frozen, as Congressman said, at minus 80 degrees, and we're receiving that at certain locations. And once it's thawed, we have 5 days to use it. And once they mix it up, it's only a couple of hours that they really have to use it. The Moderna vaccine is a little more flexible. Once it's at room temperature and in a refrigerator, there's 30 days to use it. So we are working actively with all the healthcare partners in the county, including reaching out to all the providers. We're constantly getting inquiries around this. And so the way I expect this will happen is that when we get to the point, which is not too far away when you'll be eligible to receive this vaccine, we'll make that vaccine available either through your provider or through another healthcare system in your area. And they'll be given some criteria, and you'll be eligible to go to those locations. So soon we'll be posting information on where individuals like yourself will be able to get the vaccine, either directly from your provider or at different locations. And in your case, it would be somewhere up in the valley.
Thank you so much, Doctor. Appreciate that answer. And thank you to Ruth for our first question. We'll go right to Nancy next from Pacific Palisades. Hey, Nancy, thank you for joining us. What's your question?
Okay. First of all, thank you, Congressman Lieu, for all you do for us. And my question is, what do you anticipate the congressional response will be to a recent assertion of Russian cyber attack?
Thank you for your question. So I'm one of 4 recovering computer science majors in Congress. That's likely going to be one of 3 next term since a person retired. And from my perspective, this is likely one of the worst hacks in U.S. history. The Russians infiltrated a company known as SolarWinds, and that company was everywhere in both private sector companies as well as federal agencies. And the public reporting is that over 18,000 customers of SolarWinds were compromised, including federal agencies that had access to nuclear materials. That's just unacceptable at any level. And our agency is still trying to assess the scale of the damage. The public reporting is that earlier this year, they were selling access to SolarWinds to anyone on the dark web. So who knows who could have purchased that access? It could have been, for example, North Korea, or it could have been criminal hackers. It could have been virtually anyone. So it's really difficult to know the scale of this damage, but it is really, really bad. And I do hope that we can prevent this kind of attack again in the future. One thing we've realized is that third-party vendors are a weakness in our cybersecurity. So I'm working on legislation to make sure that third-party vendors get tested in their software and there's monitoring of their software. And I'm also working to create a select committee on cybersecurity to address these issues, because right now in Congress, there's no central focal point to address cybersecurity. So thank you again for that question.
And appreciate the answer again, Congressman. Thank you so much. We'll go to Natalie next from Calabasas. Hey, Natalie, thank you for joining us. Go ahead.
Hi, thank you very much. My question is regarding testing for COVID. I'm wondering if there's going to be any county sites in Calabasas and or in the Agora Hills area. Right now the closest is in Woodland Hills, and many times we can't even get in because it's booked.
Natalie, thank you very much. Appreciate your question. I will point that need out to my colleague in Department of Health Services who helps leads the testing. I am aware that even though we have over 150 testing sites throughout the county, for some of these there's quite a backup, just like you said. And I'll note that there's nothing directly available in Calabasas, and I'll see if there's a possibility that an additional site could be opened up in your area. But hopefully it is important to get tested. I do think that is important. So hopefully you're well, but for anybody who is experiencing symptoms, we do encourage you to get testing. And so while the closest one to you may be backed up or might not have an appointment immediately available, I do encourage you to find a site somewhere in the county, regardless of what you need to do to get that test done, because it can be helpful in making the diagnosis. I will point out that, by the way, flu has just really not shown up here in the county. I know a lot of people have gotten vaccinated. We were concerned that flu plus COVID could be worse than anything we had seen. We were hopeful with all the protective measures people were doing, flu wouldn't show up here, and frankly, it's hardly made an appearance here in LA County. So if you are experiencing symptoms, there is really a good chance it is COVID, and so getting a test is really important. But I'll pass on that information. Thank you, Natalie, for your question.
Appreciate you, Natalie. Thank you so much. Let's go to Santa Monica next. We've got David with a question. Hey, David, thanks for waiting. Go ahead with your question, please, sir.
Thank you, Congressman Lieu, for arranging this. And my question actually is for Dr. Gunzenhauser. I'm someone who tracks the data every day, and as you mentioned, certainly the increases in cases, 8x, and the increase in deaths, 6x, and hospitalization, 7x, are pretty staggering. That being said, there's also been a very significant impact on our restaurant and food service workers. And specifically, a lot of restaurants have gone to great lengths to establish outdoor setups. And the data has shown thus far that of the spread, very little is attributed to outdoor dining. And as you mentioned, with the nighttime and the longer nights, we're in many ways pushing people indoors. And I just wanted to get an understanding, because it feels to me and I empathize with the challenges of trying to deal with this crisis and these explosions, but I want to understand, why are we seeming to regulate, outdoor activity when it doesn't seem to me that there's a corresponding causation for, the growth, yet we are penalizing, thousands upon thousands of workers. And despite the best efforts of Congressman Lieu, our Congress isn't stepping up in any meaningful way to help these people with lost wages. So the impact versus the actual benefit in terms of preventing growth of the virus seems to be quite disproportionate. So I just want you to kind of speak to that.
Yeah. David, thank you for your question. The decisions around dining have been very difficult because we do know how important it is, not only, for people's social connection, but also because there's so many workers. As you point out, this is such a huge part of the economy here in LA County. And so I can tell you that these decisions are not made lightly. We do know they impact people's lives. I will point out that currently we're under the state order, which also requires the closure of any in-person dining. We were a little early. You probably know our health officer had made that decision, and then the state, when things became dire recently, also has that instruction in place. I'll share a little bit of our thinking, and of course, I personally am very open in the future as we go forward, discussing ways that we can do things as safely as possible. As you pointed out, things that happen outside are much safer than things that happen inside. There have been a number of studies that have looked at, the spread of the virus, and they consistently show that just being outside probably reduces the risk by a factor of 10 or more. And so, that alone says, outdoor dining is probably relatively safe compared to indoor dining. And then, you probably are aware there's a study by the CDC that came out a couple of months ago. They looked at a variety of exposures. They found that dining was the number one factor above all of the others. It was the one that was most significant. But they did not tease out indoor from outdoor dining specifically. So a lot of people have asked these questions. And then you point out that, we don't see a lot of cases attributed to this. I can tell you that across the board, with all the outbreaks we do, and today we have over 1,400 outbreaks here in LA County, and we're investigating all of them, it is very hard to find anybody who's a customer at those locations. Almost all of the cases we report at outbreaks are either the workers or they're the residents who are living in those facilities. Imagine, if we have 4 people who go to a restaurant and then we identify them as a case and we said, where did you dine? And they said, I ate at this restaurant on such and such a road. And then we say, what's the address? Most people don't know the addresses. And we just don't have a system to quickly, the 31 or the 30-some thousand restaurants here in LA County to pin down and connect different diners that were at a particular restaurant at a time. We're hopeful we'll improve on that, but the situation is for customers of places, and we know transmission's happening, it's just really difficult from an information management point of view. I can tell you that just from a biological plausibility sort of thing, which we look at, we do know that the virus is spread by respiratory droplets. I'm sure you're aware of that. And so when you take off your mask, people are speaking when they're drinking fluids, and then they're projecting their voices to people who are, close to them. The thing I think of is if I ask 6 adults in LA County to say, look, 2 of you may be infected, but you don't know who they are you okay standing in a circle within 5 feet of each other and talking for an hour and a half? And a lot of people aren't really comfortable with that because they do understand there's some risk. But I do hear you. I do hope that in the future we get to a point where restaurants could be open, and perhaps there's ways that we can make it even safer so that we can all be feel comforted with that we think there's no risk there. But I do hear you, and I thank you for your question, and we'll continue to look at this closely.
Thank you so much, Doctor, and appreciate your question, David. Thanks for being in our forum. A reminder here that if you'd like to get email updates from Congressman Lieu's office, you can press 7 on your phone right now. We had quite a queue there, but we're just about finished clearing that out, so if you haven't already pressed 7 to get email updates, now's your opportunity to do that, and we'll get your email address and keep you updated moving forward. Let's go to Karen in LA next. Hey, Karen. Thank you for joining us. You're live.
Thank you. Hi. My husband and I were told a while back that we could sterilize our masks, cloth or the paperish kind, in the oven at 165 degrees Fahrenheit for 30 minutes. Is that true? Is that effective?
It's a good question, Karen. I can't say I know exactly the temperature that would kill the virus. I'd have to go back and look, because there are some machines that are available and can be used to sterilize masks, and I would imagine that that's a possibility. But in general, I do think that with your masks, if you simply wash them, and maybe, I don't know what it is, if you have a cloth face covering, like a lot of people make them or buy them, if you launder them, and that reaches a similar temperature, not quite that high perhaps, but close to that, that should remove the virus as well. So I think that is a practice that is recommended, to just launder the face coverings, and that is established as a safe way to do that. Otherwise, I'd have to go and look. I do concern if you put them in an oven or something like that, we don't want them to burn. And I do have some concerns that it might increase the friability from the heat, and that may make the mask less effective in terms of capturing your droplets when you exhale. So I would encourage you to use just standard laundering to clean your mask, and that should be fine. But I'll look more into this so that the next time somebody asks me a question, I'll find out more about that practice that you mentioned. But thank you, Karen, for your question.
We've got our first survey question, and the only survey question will be running during this live teletown hall today. We want to leave plenty of time for questions, and we've got about 20 minutes left here. Our survey question is going right now, and you can vote on it. Would you accept liability shields for businesses in exchange for state and local government funding? You can press 1 on your phone for yes and 2 on your phone for no. Again, our question for you is, would you accept liability shields for businesses in exchange for state and local government funding? You can press 1 on your phone for yes and 2 on your phone for no. And while you're voting, let's go ahead and bring up our next question. This one comes live from Torrance. We've got Kim on the line. Hey, Kim, thank you for joining us. Go ahead with your question, please.
Hi, thank you so much. And thank you for everything that you're doing, Congressman Lieu. My question to you is, what is you and your colleagues doing with the chaos that's happening in Washington, D.C., with Trump trying to take over martial law? I have heard no one say anything on the Republican side or the Democratic side. A few people saying on the Democratic side, but no one is responding to this craziness that's happening. Could you make some points on this?
Yeah, so thank you for that question. The president, as we all know by now, does say a lot of crazy things. Now, the Pentagon has made some statements, and they again reiterated that the U.S. military has no role in deciding American elections or anything like that. So military is pushing back. I think partly what the calculus is based on President like Biden is that he doesn't want to give more oxygen to just crazy views and theories and so on, and to make it sort of a issue that will be highlighted. He just rather have this air of invincibility, which is absolutely true, that he's going to be president on January 20th, and there's nothing Donald Trump can do to stop that. And I should just walk you through that, by the way. Because the Electoral College has already been certified, the only way that election result is overturned is if someone objects, and then both the Senate and the House take up that objection. So, for example, if a Republican in the House goes and objects on January 6th when we accept the formal Electoral College results, both the Senate and the House would have to agree to take that objection up and then accept it. There is zero chance that the House of Representatives, controlled by Democrats, is going to overturn the will of the American people. So there's literally no way that Donald Trump can stop the inevitable, which is Joe Biden becoming president on January 20th. So I think the decision was made by the Biden transition team and Joe Biden to, look, let's just not give this crazy talk any more oxygen. Whether or not we agree with that, that's sort of the message we've been given, essentially.
Thank you so much, Congressman. Appreciate the answer. And thank you for our last question from Kim. We're going to go to Romy next, but Romy's asked me to read their question, so I'm happy to do that. Romy's in Santa Monica asking, many people are not wearing masks here in Santa Monica, and I live in a large 50-plus unit apartment complex. Is there anything that can be done about this? Thank you for reaching out, Romy. Congressman or doctor who'd like to start in on this question from Romy?
Actually, Dr. Gunzenhauser, can you take a first crack at that?
Sure, I appreciate that. Yeah, Romy, this is really the $100 question. We do believe that so much of the transmission that we're seeing is related to individual behavior. This is the hardest part for us to influence, and we were talking this morning in our with our director and our health officer. What is it that we can do? We do think that some people maybe just didn't get the message, and maybe more information will be helpful. But I think in a lot of situations, people have heard the information and are just refusing to participate. So we're going to try to work more closely with cities and other people of influence who maybe can help put the message out, maybe take up some approaches that are a little stricter than we've asked. Because honestly, we've really hoped for and just asked for people's willingness to cooperate here. We haven't gotten to the point where people are being fined, although some jurisdictions, et cetera, I'm sure you hear in the news, have taken up that approach. But we're hopeful that we can avoid that, but we are looking at other opportunities to hold people accountable. Because like you said, wearing a mask, and if you're an asymptomatic infection, you could be passing the virus to someone, and so that's obviously an unsafe behavior.
Thank you so much, Doctor. Appreciate that answer. And Romy, thank you very much for your question. Appreciate you joining us. Let's go to Patricia next from Brentwood. Got Patricia live now. Hey, Patricia, thank you for joining us. Go ahead.
Yes, hi, Doctor. I wonder if you have a suggestion how we can answer people that are in the panic mode. I have friends from out of state, and they're just, talking you can't go to California, Los Angeles specifically. I'm talking about Los Angeles specifically. And that the panic is setting in on certain levels. And how would you answer these people? What could we say? Because the statistics are frightening, but there's got to be a more rational viewpoint about it.
Yeah, well, I appreciate your question, Patricia. It is true. People are not only very concerned, but it is at the point of panic for some people, and more so for some. I mean, there's a couple of things. I think, first of all, there's a higher level of anxiety among all of us just because of the situation. This is an experience none of us has ever had to deal with. And so we all can relate to this, right? We all have some level of emotional discomfort with the current situation. So this is something we should acknowledge just among ourselves, and just acknowledge that we're all having this stress, and just put it out there and talk about it with one another. And that in itself can be healthy. Just acknowledge we're having this issue. The second thing I would say, of course, is do things that can be joyful. I don't mean to distract from the issue here. I'll talk more to that. But think of creative ways to create joy. And so I'm not sure exactly who you're talking with, but when you do talk with them, you might say, I realize this is very stressful to you, and maybe suggest some ways that you've put into practice or you've heard from others. There might be ways for them to shift their thinking into things that are more positive or constructive. But I do think that the real answer is this, and that is when we do look around to places that have been effective in controlling the virus, just following the things that are recommended make you safe. That's the most important message. And so it's important to recognize this virus is transmitted person to person. So if you're not in proximity to another person, if you don't see anybody all day except the 3 or 4 people in your household, you're not going to get that virus. So it's just good to acknowledge that fact. Then if the person has to do certain things, such as travel or go somewhere to an essential activity, as I said, I think it's very important to visualize that whole experience. And that is, what are the risks that could happen? What if suddenly 10 people are at the place I want to go? You should envision that at the beginning and say, well, a safe approach is to stay away and come back later, etc. And I think that if you focus on that approach, to really, instead of dealing with it sort of in a vague, nebulous way, to actually visualize the experience that they're concerned about, you can identify practices that can keep the individual safe. So I think a combination of those factors is a solution. There may be other folks here who've got better ideas than I do, because this is just a personal experience and how I'm trying to approach this. But we are in an extraordinary time, and I do think extraordinary times do require us to do a little more deliberate thinking and planning and have these conversations, get these issues out in the open, recognize them, and collectively say, how do we solve this so that you're safe, I'm safe, and we're going to get through to the other side at the end of this pandemic. Thank you, Patricia, for your question.
And thank you, Doctor, for the answer. Let's go to the results of our survey question. We asked, would you accept liability shields for businesses in exchange for state and local government funding? 65% of you said no, and 35% said yes. Congressman, any thoughts on the results of that poll?
Thank you. The reason that we asked that poll question is these are two issues that were not included in the final COVID relief package. It might come up again next year, so I wanted to sort of have a sense of the response of my constituents. And the state and local funding is really important because a lot of it goes to first responders, such as those who are addressing this pandemic every single day and risking their lives. On the other hand, you don't want to have situations, for example, where you're protecting, the meatpacking industry and they're putting all these folks at risk by taking all these risky actions and be shielded from liability for that. So it is a difficult issue. So the poll response was helpful to me, and I do appreciate people responding to the poll.
Thank you so much, Congressman Lieu. Really appreciate that response. And I believe we are going to go ahead and wrap up here. We're just about out of time. We've got a few minutes left. So, Congressman, do you have any closing thoughts before we do wrap up our call here?
I do, but let me first have Dr. Gunzenhauser give his closing thoughts, and thank you again so much for your time today. So why don't we do that, and then I'll do the close.
Okay, glad to make a few comments. Again, I do want to thank you, Congressman Lieu, for hosting this event and for including us. And I really do want to thank the audience for your thoughtful questions. I realize some of them we can probably do better at, so I'm taking notes on everything that's been asked and said and going to go back, share this with my colleagues, and make sure that everyone's aware of the concerns that you've expressed and think through how we can do things better for all of you. Our Department of Public Health, your Department of Public Health, we have telebriefings every week, and we have a lot of dialogue with a lot of folks around all these important issues. And I have found feedback and questions from you, while sometimes they're challenging, to be the best voice for us to figure out what we need to focus on. I do hope you do appreciate the seriousness of the situation. My sense is everyone does. I realize that there are some challenging situations in our communities, and I appreciate your questions. How can we solve those together? And I do think it's a dialogue on how whether it's getting our restaurants opened up or whether it's getting people to wear masks who aren't out in Santa Monica. Those are things we have to work on together. We don't have the solution ourselves. And my promise to you is we're going to do everything we can to keep LA as safe as possible, get the vaccine out to everyone. And again, when your time comes up, I do encourage you. The last thing I would say is please be careful. The tendencies to want to get together with folks over the holidays are just so strong. I feel them just like you do. And having to make decisions that are really denying me those in-person contacts with family and people I really care about are really difficult. But this is a once-in-a-lifetime situation. How we behave in the next 2 weeks over these holidays will define what point we're at the end of January. It really is in our hands. And so not only the actions that you take, but the conversations that you have with other people to influence their behaviors that can protect all of us can really make a big difference. So I just thank you all for your help in all of this, and I wish you the very best of holidays. Thank you again, Congressman. It's been a real pleasure to join you this evening.
Thank you, Dr. Gunzenhauser, for all your time tonight and for your insights and for your decades of public service. Really appreciate it. And I want to thank everybody for joining this call. And let me conclude with some hopeful words. I do honestly believe hope is on the way. We already have 2 vaccines approved for distribution, the Pfizer vaccine as well as the Moderna vaccine. Additional companies are making vaccines that may come online soon as well. And we know that these vaccines are quite effective. So 6 months from now, we're not going to be in the same situation that we are today. At the same time, Congress did put down a COVID relief package that was a down payment on helping the American people. It is clearly not enough, and it's not as big as I wanted, and I think the stimulus checks were far too small and unemployment was far too small. But something is better than nothing, and when Joe Biden gets sworn in on January 20th, we're going to try again and get additional stimulus funds out to the American people. And in the meantime, please wash your hands frequently, engage in social distancing, and wear a mask in public. And with that, have a happy holidays and a wonderful new year. And thank you so much for being a part of my district and being on this call. Have a good evening.